A little more than 2 years into the COVID-19 pandemic, the U.S. has recorded more than 1 million deaths attributed to the disease.
This is an extraordinary number of lives lost to COVID, the vast majority of whom we would not have had lost in this time otherwise.
The most recent CDC data show COVID is the third leading cause of death in the U.S., after heart disease and cancer, and life expectancy dropped by about 2 years as the pandemic took hold.
So as we cross the threshold of 1 million known COVID-19 deaths and look back, what we see is really a surge in deaths that has hit the U.S. unevenly.
For some groups, the risk of severe outcomes from COVID-19 seems to be higher. But who are they and what made them more vulnerable?
The coronavirus in Washington state now reporting at least 15 deaths.
A cluster of infections at a nursing home in Kirkland.
At Life Care Center, the epicenter of the U.S. outbreak.
One of the first major outbreaks that we saw was in a nursing home in the Seattle area. And that was kind of the harbinger of what we would see really relentlessly for the first year of the pandemic.
COVID has hit residents of nursing homes and other types of long-term care facilities particularly hard. Federal data show nursing home residents in the U.S. represent less than 1% of the overall population, but make up at least 15% of recorded COVID deaths.
There are two reasons for that. Number one is people in nursing homes tend to be older. And secondly, they also have more illnesses.
Since the pandemic began, nearly 3/4 of COVID deaths have been among people at least 65 years old. After vaccines were introduced, the share of deaths among seniors went down. But this group was hit hard again during the recent Omicron surge. Older Americans are more likely to have underlying health problems, like heart disease and diabetes that can complicate COVID infections. In nursing homes, the highly contagious virus could infect the frailest people who were living in close confines.
It became clear that it was just really, really difficult to keep the virus out of these facilities. One issue, obviously, is that you have staff who live in the community and come and go every day.
At the beginning of the pandemic, millions of office employees began working from home. But a class of employees deemed essential, including those who work at nursing home facilities, had jobs that required them to leave the house.
Having that kind of frontline job, whether it was in healthcare or at a meatpacking plant or elsewhere, meant increased risk of being exposed to the virus.
It's unclear exactly how many people in a particular profession died from COVID because the CDC doesn't publish COVID death data by occupation. But a study among Californians from UC San Francisco found that essential workers like food service, healthcare, and retail employees faced a greater risk of death in 2020 compared to pre-pandemic numbers.
They didn't have the luxury, like many of us had, of staying home and sitting behind a laptop. They still had to go out and be in harm's way.
Data from the U.S. Census Bureau show that people with lower incomes are much less likely to work remotely.
That group, of course, was at greater risk of getting COVID, and that group was disproportionately people of color, which explains a lot of the eventual racial gap that we saw in COVID.
While most COVID deaths in the U.S. are among white people, who make up the majority of the population, certain non-white groups have a higher COVID mortality rate.
It's a higher number than you would expect given their numbers in the population. Certainly, the Black population and the Hispanic population stand out in that regard.
Public health experts, including those at the National Institutes of Health and the CDC, say that disparities stem from many factors, like pre-existing medical conditions and access to health care.
The proportion of underlying illness in this country is not evenly distributed by racial groups. We know that Black Americans are more likely to be sick with hypertension, diabetes than are white Americans. That, in turn, is a product of long-standing systems of marginalization that actually result in greater burden of illness among Black Americans.
Epidemiologists say the true U.S. death toll from COVID is likely even higher than 1 million. This includes deaths that were misdiagnosed early in the pandemic when the disease was new and tests were scarce.
So there were probably more opportunities at that time, at least, to misclassify a death as something else, maybe call it influenza or pneumonia, for example, instead of COVID-19.
Excess deaths associated with the pandemic have reached more than 1.1 million, according to the CDC. Some of those deaths came from indirect fallout like deferred healthcare and missed health screenings. Experts say it will likely take years to fully realize the pandemic's toll.
But 1 million deaths is 1 million parents, grandparents, cousins, uncles, lovers, friends. It's 1 million people. And nothing redeems a tragedy like that. But it seems to me like we are not honoring the tragedy if we do not learn from the moment so that we can improve.